Welcome to Making Rounds on Planet Vero Radio and TV. And here's your host, Jennifer Toby and Treasure Coast Compassionate Care.
Well, hi, everyone. I am filling in for Jennifer Toby. I am Cindy Schwartz. I'm usually behind the scenes, as you can see. This is going to be my board right here today. And Jennifer Toby did the honor of me allowing me to do the show for her today. Jennifer is in Houston. She is with Hurricane Nicholas. They are also with the Cajun Navy with Hurricane Ida. So I know everyone's sick of listening about the hurricanes and stuff. It gets so trying, and there's so many people that are hurt and devastated. Their housing is gone. Their livelihoods are gone. Last week we had on the show, there was a lady that talked via phone that her business was looted, that she didn't have insurance. There were people that were stuck in nursing homes and stuff that they were just left. The people that the caretakers just left them in the nursing home to fend for themselves. So I'm curious how that worked out. I know Jen's going to be on top of that. But Jennifer Toby, thank you so much for letting me do this. And I want to give kudos to Treasure Coast Compassionate Care, because that's what I'm going to talk about on the show today with a lady who is my co-host. We actually do a podcast. Her name is Jeannie Roller. She's in the Indiana area. And we talk about medical stuff, and we call ourselves Patient Partners. That's the name of the podcast. And we try to educate people in the two things in the medical field, because we found firsthand being harmed. Jeannie Roller's husband was harmed, having our own surgeries at big hospitals. And this is in different states. It's happened in, all over the country. And we found that we're the advocates now for ourselves, because we didn't know the questions to ask. We didn't know what things to delve in. We trusted, what do you do when it's the first time you're facing a major surgery? And so when things went awry, which they did for both Jeannie Roller's family and my family, we decided to take the cause up and start to educate ourselves on what different scenarios we could come up with and what just different interactions that we have. I mean, is the big hospital the best thing? What kind of drugs should we have? What things should we ask? Because there's really there's no book, there's no pamphlet, there's no one that's going to tell you this stuff. You literally have to either figure it out for yourself, or you just kind of go along with it. And then when something happens, we've found that there's nothing or no one that backs you up to the extent that you think is going to happen. So yes, we've heard about patient advocates. We're here to say that didn't really work for us. We went to admin in different places. We went to our legislature. We went to our state governors, our attorney generals, different things like that. And again, on the podcast that we have on Spotify and Spreaker, iTunes, it's across the board on the distribution channels, we talk about those things, and we interview people of the scenarios of what happened with them and what can be done differently and what roadblocks were put up against them. And so today, I want to say, I started off saying I wanted to give kudos to Jennifer Toby, because I know her company, Treasure Coast Compassionate Care, is the type of care that people would look for. And that's the type of care that we expected when we signed on for the surgeries. Now, Jennifer Toby doesn't do surgeries, but she does take care of patients, and she does take care of nursing home type patients, those different things in home care. And I hope I'm giving you kudos, right, Jen? And those are the people that we'd wanted to go to. But how do you know that you're going to go to a bad person, quote unquote, for lack of a better word, until you get, knocked upside the head and go, wow, this isn't really what I signed on for. I mean, this wasn't on the informed consent. This wasn't told to me. I wouldn't even have known to ask a lot of this stuff. So I'm going to put on Jeannie Roller now, and we're going to talk. Today's subject is a main thing that's been in headlines with the OxyContin epidemic. And now we're looking into fentanyl, and today specifically Versed, also known as midazolam, which is a huge drug that was discovered, invented, made back in 1974, and then came out into prevalence in the surgery scenario in 1982. Now, again, Jeannie Roller and I are not doctors. We're not scientists. We're not pharmacists. We aren't anything like that. What we are is we're our own medical advocates trying to get the word out for hopefully help other people to be able to know to ask these questions and to know that this is some of the stuff that is going to be used on you, and maybe you will have some serious reactions to it, and you should know some of this above board. So that's what our mission is, and I, again, applaud Jennifer Toby for allowing me to have this show today to talk about this stuff. So, Jeannie Roller, you're in the Indiana area. How are you doing today? And we want to get right to this. We want to talk about Versed and the bad, the good, the bad, and the ugly of it, and let people know.
Experience with many people don't know that they're going to even have it. Mm-hmm. That's where the lack of informed consent, because generally they'll come in and say to the patient, hey, I'm going to give you a little something to help you relax. They have no idea what this drug really is. Usually it's given in combination with fentanyl. Maybe sometimes it is given in combination with another type of opiate, but usually it's fentanyl. Versed is not a painkiller. Its three main properties that it's used for is to make the patient cooperative so that you don't care what's happening to you. The other property is that it makes you uninhibited, so when they strip you naked, you don't care. And the third property that they really, really like is that it will, 90% of the people that they use it on will have complete memory loss or major memory loss. Now, that is a problem if you're not told what this drug does, and many elderly people aren't told about this drug, so when they go home after procedure, they think that they have lost their mind, they're becoming crazy, and many of them never fully recover because they don't know what happened to them. They don't know why they can't remember. And this isn't just something I'm saying. There are studies out there that prove this, that it is particularly bad for older people. Older people or extremely sick people should be given reduced doses. In my husband's case, he had refused it altogether, but he wasn't given any reduced dose. So at 60 years old, they say that you should have a reduced dose. Well, he was 67 and he had supposedly had a heart attack, so they didn't reduce the dose. He didn't know he had it even. So there's a lot about it that people don't know. I don't know why they come in and say, we're going to give you a little something. I don't know why they do not seem to believe that you have the right to make decisions about what is injected into your body. Mm-hmm. That's the really concerning part, that they do not believe that you have the right to know.
I'm going to interrupt you there for a second, and I'm going to key on a couple of points that you made. So, yeah, that's the first thing. I mean, we don't know to ask this stuff. I think worldwide and especially nationwide, and I know in my own particular family, there was serious instances with OxyContin. I won't even go through the stuff that happened. It's just horrendous. The people's lives that were destroyed, children's lives that were destroyed from that drug itself. I have talked with other people on this show, other shows, about fentanyl, and they say everyone agrees, yes, that's going to be the next epidemic. It already is an epidemic. It's already out there. And the other one is Versed. And I get it, going back to the research that you and I have both done, they, back in the day, kudos that they invented a drug that will allow these unbelievable surgeries that people do need that weren't possible years ago. And these are the high volatile drugs that they found that works, and other stuff. Again, I'm not a doctor. But why now, and this is me talking my own opinion, why now are these same drugs, if they are specifically for those type of surgeries, given willy-nilly to everyone now? It's like across the board. We had John A. on our podcast Monday, and he said he was going in for hand surgery for his index finger and another finger, and they were giving him these powerful drugs, and he's like, I don't need that stuff, and why can't some of this stuff be done outpatient?